model right here. Welcome back to Let's Talk Live. We are excited to see American athletes doing so well at the Rio Olympics, especially in swimming programs. But you can't help but notice those red round marks on the athlete's body, like Michael Phelps. Well, do you know what they are? Dr. Ziegler is here from the Advanced Health Center joining us today to tell us all about it. So we are now becoming familiar with the term cupping,
right?
But we don't know what it is.
Right, and most people really don't. Michael Phelps has taken something old and made it new again.
Okay.
Cupping's been around for thousands of years.
Right.
And we're starting to see those marks, and people's been saying, hey, what are those red marks on him? So today, my colleague Tetsuhiro Ueno, he's a licensed acupuncturist and herbalist, is here to kind of explain and show people what cupping is and what it does and how it can help in speed recovery.
Okay, well, Tetsuhiro, why don't you tell us about the cupping? Show us what this is.
Right. So before doing cupping, I just want to explain any kind of pain or muscle tightness is caused by like poor circulation of your blood.
Okay.
So we can improve the situation by doing acupuncture, herbal medicine, massage, and cupping is one of them.
So it's like a deep massage.
Yeah, like
not
a deep
just,
massage.
Okay,
yes.
like rub it here.
Right.
Okay.
So by improving the circulation, we can eliminate some pain. So that's what cupping is all about.
That's what cupping is. Okay.
So what cupping actually does, it's what we call a negative type of pressure. It expands the capillaries, bringing blood to the surface of the skin. That's what you're seeing on Michael Phelps, or those red marks. You're expanding those capillaries, and he'll demonstrate of that technique.
Yeah, you can go ahead and do that. I'm going to keep asking Dr. Ziegler here some questions while you do that. So I understand it's bringing blood, the capillaries up to the skin, but how does that relax the muscle?
Great. So there's two different types of techniques. There's a newer technique, but there's a traditional where they use a glass one. They heat it. This vacuum actually pulls and draws the blood. By getting more blood into the muscle and the connective tissue, it starts to relax. It brings more nutrients and affects the ATP of the cell, enzymes, helps get lactic acid out. And then there's the other mechanical type of cupping that Tetsuhiro Ueno is going to demonstrate, which is also going to cause a vacuum type effect, a negative pressure on the muscle.
Okay. Right. So we'll go
so
ahead
you're
and
going to use this like pumping machine to attach to this cup.
All right.
And
can I hold this one cup while you do that? Yeah, go ahead.
Yes, apply to the area.
Okay.
And sanction.
Oh, wow. Now, our model, unfortunately, is not mic'd, so I can't ask her what it feels like. Can you kind of just, with your right hand, give me a thumbs up or a thumbs down? Do you feel pressure, or does it hurt at all?
Yes,
okay. So
and that negative pressure, what you're seeing as you're actually drawing blood right into that connective tissue, helps speed the recovery. These athletes are looking for everything they can to help them do something more naturally.
Right.
And again, speed their recovery.
Now, how long do you leave this on? How long does the suction last?
So this will actually stay on an athlete for probably about 5 to 10 minutes.
Right. Okay. Now, you said it helps break up the lactic acid.
Correct.
Which is why we usually hurt. Like for normal people who don't work out every day, when you do go to the gym and you work out, it hurts.
Right.
Where does the lactic acid go?
The lactic acid gets stored in a lot of our muscles, our connective tissue, and then what happens is we have to drink water, we have to flush it out. This is another area that as we start to remove the toxins out of the tissue, we're going to drink water, help our kidneys, and start to flush it out of our system.
Okay, so what is the difference in, so this is like I'm assuming a deep tissue massage for the athlete or for the person?
The technique you're seeing at the Olympics is called a myofascial decompression. It's not completely similar to the acupuncture traditional meridians. It's a special technique you're seeing that has been done by physical therapists, trainers, acupuncturists, herbalists. But this technique again is what we call this myofascial decompression.
Okay. Now, is this safe for anybody and everybody? Like you're sitting at your desk, and you get neck pain because you've been looking at the computer too much. So
we talk about this often in the office. Please don't buy this on Amazon. Don't buy don't buy these kits. Licensed professionals who are trained to do it. You can damage the skin. You can cause blistering. You can actually cause infection. Don't go on Amazon and start buying. I don't want to see everybody doing it to each other. Knowing what to do not to damage the skin. You can actually get permanent skin marks from this.
So let me ask you this. Are there certain people that are not eligible for the cupping? For example, I'm on a blood thinner.
Right.
Yes. Okay, so now we see, some like our athletes in Rio who look like they have large hickeys on their body. I'm imagining if you're on a blood thinner and you're pulling the capillaries up to the skin, you're going to be bruised really bad.
Yes. And it's the permanent scarring we talk about. We don't want people to get permanent scars. And if you don't know what you're doing, and you don't know what's going on with the patient, it's really not a wise thing to start to to do.
Right.
Really seek a healthcare professional to help you.
Okay, so Tito, can we take those off real
Right,
quick
yes.
just before we get ready to end our segment here? And we'll see how our model looks.
Right.
Sweetie, you've got a beautiful face, but if you don't mind just sitting up so we can see the back of you and we can show this on camera, I think that would be great for our viewers to see at home. Okay.
Yeah, she did great.
Yeah, you did great. Okay, and now typically how long would this, now we only did it for a few moments with her because of the timing of the show, but how long will this coloration last typically?
Yes, at least like few days for sure, but could be like 1 week, and it depends on how much circulation you can have, so it could be longer too. So just be aware of this kind of.
So you feel pretty good? Can you move around?
Nice and loose.
Nice and loose. That's what we like. All right, well, Dr. Ziegler, where can we find you guys and get more information if we're interested in coming in, and talking to you about this?
We're at Advanced Health Center in Arlington, Virginia.
Okay.
We've been there for 25 years practicing more holistic and types of medicine. We want people to do things more holistically, which is nice to see these athletes again doing things much more holistically.
Instead of always popping pills.
Yeah.
Right.
Yep. All right, well, thank you guys so much for coming. And you may now turn around, beautiful, and let everybody see your pretty little face. Thank you so much for being our model today. We appreciate it.
Thank you, Lucy.
Thank you, guys. All right, well, we're going to sit down with this